I need to say anything?
What are you doing?
I'm looking at...
Wasting time. All right, Dr. C, let's go.
Okay, folks. All right, so this is the deal. H-E-A-L-T-H, Men's Health. Okay, so today was a special day at the Austin Gynecomastia Center. And obviously we're filming before you're actually able to capture all this is what's going on. But it's a real special day because after the culmination of 15 years as the Austin Gynecomastia Center and helping literally thousands of patients and educating millions. Today's special because Men's Health magazine is in here doing a story on gynecomastia. And so what I want everyone to be clear about is that this isn't a story about me. It's a story about essentially gynecomastia. And hopefully you who are watching this, and maybe you have gyno or you know people who do have some gyno. So this is a personal, sensitive issue for me. That's why I treat so many gynecomastia patients. We really think we do a wonderful job. We think we educate. We think we get it. We think we understand what this is all about. And the mission of the Austin Gynecomastia Center has always been the simplification of the diagnosis and the treatment of gynecomastia. What I'm hoping what we've accomplished today with Men's Health magazine is to give within a day, I guess we had 3 cases in a row. They were progressive cases of difficulty and bigger and more complicated. Give the editor an idea of the issues that are surrounding gynecomastia today. Like, what is it? And how significant is it? And is it a condition that's worthy of them publishing in their magazine? And basically the answer is a big yes. And the reason why is simple. This condition can affect up to probably 15 to 25 million men. That's a lot of men. That's a lot of guys that are really brought down in a lot of ways because they have a condition that a lot of people are not even familiar with. So what I'm hoping is that this editor can pick up on everything that we've done today and sort of get a concept of what gynecomastia is and relay that in his article. And I'm hoping that this will be sort of the aha moment for the country and maybe the world in terms of recognizing a condition that affects men, that is underappreciated, not even understood very well, but something that is actually eminently treatable. There's no reason why people should be walking around with this condition because we know how to treat it. We know how to treat it very systematically, very thoroughly, in a very short period of time with a short recovery. So the benefits are just all over the place to having treatment for gynecomastia. So anyway, that's why this is a special day today, and we hope that we have a big impact on the world of gynecomastia through our day today at the AGC.
Talk a little bit, I would like to get a little more specific on how the timeline on which you turned to doing this so much. Like,
Okay.
When did you do your first gyno?
Well, first gyno I did in my residency, so that was like 30 years ago.
Okay.
But I probably have done maybe 4 or 5 in the subsequent 15 years.
Only
Maybe.
did a small.
Yeah, most people don't really do a lot of these.
Uh-huh.
I mean, it wasn't something that we saw much of.
So
at all.
15 years ago, maybe you started doing more.
Oh, 15 years ago, yeah. I mean, actually, we graphed it plotted on the scale, and 15 years ago we did 3 one year. The next year we did about 6, and then I think it was a subsequent year or 2 we went to 50, and then it went up to 150. And now it's 300.
Okay, Alan, this is Tom. And
Hello.
Monica is
Hi.
here.
Hey, I'm Tom. Hang on, I'm wiping some marker off of my boob.
Y'all get comfortable. Let me know if you need
It
anything.
looked like a big mole.
Hey, good to meet you.
Nice to meet you.
Yeah, thanks for taking a few minutes to talk.
No problem.
Appreciate it. Have a seat if you want to.
No, I'd rather stand.
All right, I'm gonna sit if you don't mind.
No, I don't care.
So, did they tell you a little bit about who I am, why I'm here?
they said you work for a Men's Health magazine.
That's right. So I write sort of lengthy magazine articles where I go and I spend, like today I'm spending all day here with Dr. Caridi and the team, going in, watching multiple procedures, talking to other patients, talking to follow-up patients, just talk to somebody who's 4 weeks out from the procedure and his life has changed.
Right.
The premise of the article is something I think you probably know really well, which is here's this condition that a large number of men have that doesn't get talked about.
Absolutely.
Right? And here's this guy who is one of the, 2 or 3 guys in the world who's like a real destination surgeon for this, and who seems to really understand like this aspect of it, how it just worms its way in and affects people's behavior and all of that, right? I think that's a fascinating article, and like relevant to, so when you think about men's health and the audience of that brand,
Right.
So I want to hear your story, basically.
Yeah, well, I mean, I totally get it. I mean, so I started out I remember I played baseball,
Yep.
and when I was around 10 years old, we got our trophy pictures taken,
Yeah.
and that's when I first noticed I was hunching over, leaning over to keep my shirt, hanging straight so it wouldn't show up. It really is mostly mental, I think. I mean, of course it's noticeable when you have something as pronounced as what I did, but a lot of it is mental because you do things naturally, like wear 2 or 3 shirts and wear a wife beater underneath your t-shirt and then wear a button-up shirt just to hide it so you can...
You were wearing a wife beater, 2 t-shirts, and a button-up?
I can't remember ever
you were
going anywhere without
3 or 4
wearing
shirts.
at least 2 shirts. Always
And often
button-up
more
shirts.
than 2.
It would be like a t-shirt, a button-up, and then some type of jacket or vest or something like that.
Layers would help, and plus your posture,
Yeah. So you would sort of hunch.
Always.
When did you first take the vest off and see? When was that?
About 10 o'clock this morning.
This morning. So after yesterday, you have the procedure yesterday afternoon or morning or?
11 o'clock.
It was 11:30.
11:30.
He was done by 1, and they showed me, but he was still laying down a little bit loopy, and he probably couldn't look down and see. But I was like, oh my god, like I just couldn't believe it.
Yeah.
And so
And-
he, I don't think expected the results that he saw this morning at 10.
But so you went back to the hotel room and you were wearing the vest and you went to bed wearing the vest. You didn't look at it really at all because you just had this vest. It's like a compression vest.
Yep.
Yeah. So
I didn't want to take it off because I know it's there to keep everything pressed down.
Right. You just don't want to mess with its healing.
Yeah.
So this morning you take it off. Tell me about that moment.
Well, I was in the mirror and
In the hotel. This is in the hotel room or here? This is in the hotel room.
she was helping me. I was going to get a shower, and we took the vest off, and I don't remember the first thing I said, but it was just talking about all the things that I can do now, and I actually teared up, and she did too, and it's just a life-changing thing. I mean, it's just so many things that are going to be. I mean, this right here is amazing to me. My whole life, everybody that I've ever mentioned it to, guys in particular, you just got to do a bunch of chest exercises, right?
Yeah.
Butterflies and bench press and stuff. And when I was in my 20s, that was actually, I still believed that. And before I ever heard of gynecomastia, I mean, I was like, okay, I just got fat chest.
Yeah.
So I actually worked out for 2 or 3 years, and I mean, I got in really good shape, and it made it look worse. I mean, they were more pronounced because I was in good physical shape, and so then my sister's a nurse, and she gave me a packet on it about this procedure and all this stuff. So since then,
when was that?
Probably I was about 23. So
So a while ago, 15 years ago.
So since then, I have actually looked into getting this done. A couple years ago, I started looking into it again seriously because I got a new job and I was making a little bit more money and had more freedom for where I take time off. And I thought, well, I'm just going to start saving my money and I'm going to get this done.
Yeah.
So I looked into where I live in Kentucky. Louisville is the closest biggest city.
Okay.
So I started looking into Louisville, and a couple specialists
Yeah.
that do this procedure, and you look on their sites, and you know, before and after, they'll have 2, maybe 3 of this procedure,
Yeah.
and hundreds of women's breast augmentations, but I don't feel comfortable with that.
Yeah.
And then as soon as I saw Dr. Caridi's Austin Gynecomastia Center, and then they said out of town, get it done in 34 hours, you can get here, fly in, get it done, do the video consultation. All the places I've contacted before, well, we want you to come in, you got to do a mammogram and all these tests to make sure that you actually have a condition, because, you know, it has to be diagnosed. And it was just a pain.
Yeah.
As soon as I told her when I saw it, I was like, I mean, it was actually probably 10 minutes after I was on his website, I was in there taking pictures. I had her take pictures to send to him. And I emailed Dr. Caridi on a probably Saturday night. It's late, probably 9 o'clock on a Saturday night. Expected maybe Monday morning I'd get back. And it was 30 minutes later, 10 o'clock on Saturday night, he texted me back, or
He
emailed
did.
me back. Yeah, he did.
The thing that I get from all my emails is the same. Basically, I can't believe how freaking fast you answered me. Because basically, this is the beautiful thing. When you're in a hospital and you're in a hospital situation, the inefficiencies are ginormous. And if you're a surgeon, you're basically just waiting and waiting, and it's just ridiculous. This place is like super efficient. You know, we got the same A team. We've been doing this for a long time. We can turn stuff over in minutes. So what that does is it frees me up to just sit here in my office. And so I could literally, you know, boom, get in, answer it, and boom, and I'm at home, I'm on my computer, and it's something I realized that's what they'd love.
Yeah.
I mean, who doesn't, right? I mean, you know, it's really almost an instantaneous response. You send me an email, and more than likely I'm going to get back to you just right away.
Yeah.
They appreciate that. They'll always write, hey man, I really appreciate you getting back right away. I mean, you know, it's obviously a nerve that when you hit, it helps. So if I were to give anyone advice, don't wait 2 or 3 days.
Yeah.
They want to know. I mean, it's almost as if they have gotten to the point where they're willing to reach out. And then as soon as you make that connection, it's you. You know what I mean? It's a connection. It's an electronic thing. It's a digital thing. You're not seeing that person other than this picture, but it's almost like you make an internal human connection that, okay, this guy cares, and he's spent the time to answer me on a Saturday or right afterwards. So they want you invested.
Yeah.
They want you excited. And I think some of the stuff they see in me is I'm a little, you know, I'm excitable, obviously, and I'm into it. And so yes, like when do I want to retire? When I'm not into it, and when I'm no longer of use to these people spiritually and physically and with my hands, you know. I mean, I still have my hands, obviously, and I'm still interested in them, and they're still interested in me, and it's really this like kumbaya.
Yeah.
It's really kind of cool. And so you can imagine what a great way to have a practice, and people that travel from afar. That's the stuff you dream about. Yeah, you take a break. Taking it all in, huh? But you get the flavor. Yeah. But I think you
probably put this in a whole entire magazine.
what are we missing? Are we missing anything?
I'm just gonna go back through looking at my notes before I came in.
Okay, John. So you want to do? So this guy, you filming us, John? Here.
Yeah, you're rolling.
All right. So this patient has pro-hormone and hormone. He's oh boy, he's done a lot of stuff. He's got hormones. He's got pro-hormones. He took some stuff over a period of time and developed this gynecomastia, which is pretty typical, and it's glandular in nature. So you can easily feel he's got a mass present here, and you can definitely see the size of his areola. So if we're going to try to pick up on anything today visually, you'll obviously see flattening of this area, but let's watch the size of his areola. So you'll see how his areola just responds to the pressure that's behind it, and it's that mass. And once that mass is removed, it just shrinks down. So I definitely don't need to operate on his areola to make it smaller. It's just going to go back by itself. As you can see from those pictures, he's got some big old pecs. And he's all up front in zone 1. He really is nothing out on zone 2 and 3. It's all up front. Usually those people that tend to take the hormones are the bodybuilder type, and that they're more fit. Usually, not always. And so I'm going to use the Vaser here to get around this mass and to free the glandular mass from the surrounding tissue so that we can pull it out nice and clean. And then we'll just sculpt some of the fat around. Maybe we'll use an internal flap. Maybe we'll use a quilting suture to eliminate dead space. But that'll be determined depending on how this goes. He's got excellent skin, which is always a good thing. And never have to worry about how his chest is going to look when his skin is of high quality, because that really is the #1 determinant of somebody's result. If your skin isn't of high quality, then you're going to have some contour irregularities potentially. So think people with weight loss, think people who genetically have poor skin, and think about older folks like myself. I mean, people over...
No, he's young.
He's young, yeah. Young people generally have great skin. Let me tell you something, it's great to be young, but us older folks, and what do we mean by older? When do you notice skin changing? Probably 40s. It's variable. I know everyone hates to hear this, but I'd probably say 40s our skin starts to deteriorate. And if you've been in the sun and you're more weathered, it'll go even faster. But you start to see laxity of the skin. It doesn't have that ability to bounce back as well. And so plastic surgery on any body part is generally always better when you have younger skin to work with. And you can see this is different. This is a little bit, it's yellower and it's more nodular. It's sort of like, it's not this, it's inflamed. It's still sort of active. And again, that's just something you observe after you're pushed out. But you can easily, thank goodness, it's something we can get out of here by tugging on it. And that's really attributable to the Vaser, because the Vaser really does free it up. And we're able to get, and it shrinks this mass down, so I'm able to get this mass out through a smaller incision.
Yeah.
Yes. What are you doing in here? You're starting to hang out. Hang out. Yeah, Matt's here.
Oh, Matt, so
Uh-huh.
you can have Tom speak with Matt after maybe after we,
Maybe after you get the first one out.
yeah, let's get this first one out.
Yeah.
All right, so again, you can see here that it comes to the nipple, so this mass is generally out. Now, John, are you able to get that?
Oh yeah.
You sure? So this is the bottom here, and this is the top, and it all originates at the nipple. Here's the nipple over here. And so I'm not leaving any of this, folks. I'm going to get rid of it, because I know I have a backup, and my backup is my quilting stitches, which, not my quilting, my internal flap, which I could use to rebuild the bottom, if you will, so we can have a nice normal layer of tissue to support everything so he doesn't have any depressions or concavities or anything like that. But I also want to get out of all the tissue. I don't want to leave any in. You can't come back if you remove it all. That's the bottom line. And then I think we're going to be able to have a better view of, good. Okay, so boom, already you can see this is pretty nice. And I don't need much, but look here. This is the muscle, Tom.
Wow.
Yeah.
Right there, you see this?
Yeah.
That's this red.
Yeah.
That's the muscle. That's his pec.
Yeah. Wow.
And so this thing went down. This structure here, this was the top, that went way down there and stuck right there onto this fascia on top of this muscle. And so really what I'm going to look around is see if I can find any of this normal stuff, if I can bring it up onto the edge, just to separate the...
We're on our game, huh?
It's on your desk.
Oh.
Oh, it started like that.
Oh man, I can come on in here. Oh my God. Look at you, smile, and don't panic just because there's a bunch of people here. These are all good people.
The entourage is
This is Tom. He's from Men's Health. That's Lacey.
Hey, Tom.
And this is my good buddy. What's your name again?
I don't know.
It's John.
It's fine again.
Anyway, you with me, man?
Yeah.
Thanks for doing this. We appreciate it. So you want to talk to Tom for a second about your deal?
Sure.
Tom, ask him questions.
Yeah. Well, do you want to?
Yeah. Let's
talk now
examine
or
him.
talk
Let's
afterwards,
examine.
or-
Let's examine him.
Yeah.
See, I've already met him.
All right. So, I'd love to hear your story, and let me get out of the
Lie
shot
back
here.
Sit back and relax.
What brought you here?
I was Googling things on just gynecomastia
Yeah.
online, and because I had the
And the reason why I think this is such a wonderful potential here is that this needs to surface.
Well, that's the point of the article too, right? Is what we're talking about. It's like, okay, here is this sort of this hidden thing that a large number of men deal with and don't talk about, right? And what are the effects of it, and how does it affect men, and in their daily lives, right? And that's why your story, I think, is powerful, right? It
Very
just
powerful.
shows that. So yeah, thank you very much, and yeah, we'll do first name only. That's totally fine.
You see that? Look at this. This is going to happen here in less than 30 minutes.
Yeah, how long does it take? Just takes
This will take us about 40 minutes. You'll see. You'll be there. But where is it?
right in there,
Where's the center of it?
right behind the nipple.
Damn right.
Right.
You feel the now? Feel the side.
Uh-huh.
Does that feel different?
A little bit.
Fatty.
Fatty, yeah.
Feel back.
Where
Does
is
it
that?
feel like a
You gotta
discreet
pull
mass?
that cable over here.
Like in
Right
it
in
almost
there,
like
that area,
yeah, it's in that area, but
Yeah.
you can almost feel
Yeah.
if you really
Yeah.
get underneath there, get
Yeah.
underneath there, pull it up a little bit. Don't be
Yeah.
afraid. You feel it?
Yeah.
That's gyno here, because I could just remove this, but then it's going to look
I
odd.
mean, in his case, when he was in better shape, it might have actually been more pronounced.
Absolutely.
Because there wouldn't have been the fat here evening it out. It would
Oh
have been
my
this
God.
thing behind the nipple.
Absolutely.
Exactly.
So this is the irony of it is, so those who lose weight, it often looks worse. We had that case the other day, right?
Yeah.
A patient who actually lost the weight and it looked far worse, but this will get better,
Because then
usually.
it's just like a smaller, puffier, pointier thing.
Right, it
You
just,
still
it looks
see
odd.
This is still there.
Right.
Remember, a big breast on a heavy guy sort of looks normal. A breast on a thin guy doesn't look so normal.
Yep.
All right.
I didn't do like the clear.
So, well, at some juncture, I would tell you, well, what have you learned over doing it? There is an art to gynecomastia treatment. So part of it is where to treat, and part of it is how to treat it, and then part of it is what to leave and what to take.
Yeah.
So that's the art. You have to take all the tissue. You can't leave the tissue behind. If you leave the tissue behind, generally the patients are not happy. They're dissatisfied. Okay, so again, you're seeing another relatively mild case.
Uh-huh.
But mild is sort of relative, right? It's mild in a way, in a sense that he's not this huge guy, right?
Yeah.
I mean, he doesn't have a lot. He has no body fat. There's nothing in zone 2 and 3,
But
right?
it's exactly what he described to me. It's like
Exactly.
right behind the nipple.
So
Yeah.
look at here.
Yeah.
Boom.
Yeah.
And so what I liken to is this whole idea that I tried to mention, boom, boom. It's on or off. So
Yeah.
he's got it.
Yeah.
And in fact, you can argue that his case is actually worse than the guy we just did and worse than some of the guys that are much bigger because he's all fit and stuff. You can imagine if he wears a polo, he's going to be that guy that has these kind of puffy things.
Well, he's exactly what we talked about when we were when we were in the middle of the procedure on the last one, where it was like if he lost some weight,
yeah.
what would be left is basically
Yeah,
what
just
we have
basically
here.
this.
Yeah.
So he's kind of what I call, and you'll feel this when you're in the back there, but he's definitely got a gland. This is like what I call zone 0 plus, which basically means 0 is yes, the area of the nipple complex. So there are some guys, and he's pretty close to it, they just got puffy nipples.
Yeah.
And so their gland, they don't really have a lot of fat. I don't have to really contour all over the place. It's really right in this region over here. So, but what I'll tell you is that after I remove all the gland, then there's nothing.
Yeah.
So then I have to be able to pull some stuff over, and that's where my internal flaps come in and all this kind of stuff. Now, the other thing that it's kind of an interesting thing to note is that, so his areolas are a little bit bigger than he'd like, all right, and they're bigger than normal.
Yeah.
It's a myth that, you know, a lot of docs will say, well, we got to cut around the areola to make these areolas smaller, right? Because that's what that eventually wants. But the fact is, once you take the mass out, it's like a balloon that's expanding
It
with
goes,
something. It just goes down.
Yeah.
And I would argue this strongly, that, well, even if it doesn't go down to, let's say, you know, 22 millimeters or whatever we think is ideal, it's far better to have it go down and be 1,000 times better without the potential of a scar that goes around the area that looks like a pizza pie.
Yeah.
Because that's what can happen. And especially, he's a man, he's not, I mean, what color are you? I mean, you're not white, you're not this, you're not, he's sort of in the Mediterranean, as I call it, Mediterranean color. And these are the people that when you do that scar, it looks horrible. So again, it's sort of like, again,
Because there's a color change.
yeah, it's just gonna look, and it looks like a pizza pie. It looks like the crust around the pie, and that looks odd. So it would destroy the potential for a nice result. Exactly what you can do is you can probably tattoo it, but these guys don't want to go through all those permutations.
Yeah.
Basically, get the result that you need that just gets him out of here, so he doesn't even know what's going on, right? And then they'll have this, you know, this gyno. Okay, this gyno is a mass that sits in like here, right? It starts here. That's where it starts.
Yep.
At the nipple, right? And then it comes down. When I ask you to feel that mass, you are feeling this mass. Now this stuff out here, that's normal tissue, okay? Because the one thing they don't want to admit to some degrees is that, how come I can't be a man and just deal with it? Revisions, burns, nipple areola compromise, hard healing scars, infections, wound healing issues, mondors, recurrent steroid injections. I'm just separating it's stuck, so I'm really just separating it out, then boom, here. So this is it.
The gyno is because after I started working out, like the shape of it changed. It didn't really look like fat anymore.
Gland is just true breast tissue. All right, so now that looks perfect. So that's lined out nicely.
Like yesterday, I would be so uncomfortable standing
You were
here.
standing in
Let
front
alone
of me
him
very
filming
comfortably
us.
right now.
I mean, if we were just standing.
You're standing in front of a camera and a journalist.
This
Very
guy doesn't want to
comfortably.
put his shirt on.
So everyone just makes up a number. Oh, 5%. I've heard 5%, I've read 30%. And if you put them on a scale, okay, the risks and the benefits far. And I love sweet men, meaning that, you know, forget your stuff, park it, man, and you're just a guy that had something and let it go, and he's letting it go, and she's crying. It's home. It's home. We like to think of it. This is, well, it's home for them too. It's like I try telling them, look, this is the AGC, baby. You're home. How are you? God, you are beautiful. Look at you. Good job, buddy boy. You did good, man. You did really. Do you remember anything? No. Good for you, brother.